Olga, what most common mistakes healthcare advisor boards are making that are quietly costing companies time, trust, or capital, especially in the early stage of innovations?
The way I see it is there is normally two common problems that I see with health advisory boards. The first one is a lot of times early stage startups trying to build boards that are very impressive on paper and not really functioning as intended. And a lot of times you have all of these names, advisors are listed, but there's really no clear expectations, no clear engagement, and no ongoing contribution. Another side is that sometimes those boards really have that group thinking where too many members come from exactly the same background and they tend to be, whether it's clinical or operational, all agree on certain advices while they're missing the big components of having diverse boards. That's one of the things I feel like super important. It's missing that, either missing diversity or missing operational engagement.
Today, our guest is Olga Muller, founder of Kepler Team, a digital health innovation lab helping healthcare startups with product development, EHR integrations, and commercialization. 10 plus years of experience turning complex ideas into scalable solutions. She has a combined background in applied mathematics, technology, and business with practical execution. She's a community builder supporting Charlotte's healthcare innovation ecosystem. All right, we're so honored to have Olga Muller here with us. Someone has been in our ecosystem for a very long time, a great supporter, a great advisor, and someone who's continued to help the early stage as well as develop a stage of companies to create digital solutions. And we all know sometimes the innovators like to build, right? They are so focusing on creating something that's novel or something that's outside the box thinking. However, when we're trapped in building, we sometimes get lost touch of what's the reality. Is this actually going to be adopted into the market? Can the clinical dental wellness community actually promote this, right? Because at the end of the day, doesn't matter how amazing your product and services are, if people are not using it, no one is able to actually creating the true impact you see it in your head that other people don't see. So what truly made you get into the healthcare space, Olga? Because technology and build up innovation can be any industry. What drew you to healthcare?
Honestly, it's always been part of what I wanted to do. As any technologist will tell you, most of the ones that I know would always say that technology is only as good as the way you use it and impact it creates. And to me, that always been a guiding principle in everything that I've been building, from the business to all those engagements. How much impact am I creating with the use of that technology? And exactly to your point, if you're creating something wonderful, but you don't really understand how it is going to be used, how it is going to be changing lives, and who are the drivers of that technology, it doesn't make sense. To me, that part has always been the main and deciding factor on the things I get involved with. The reason healthcare is such an obvious choice for innovators is this is where you can make the biggest impact with technology. It literally can affect people's lives.
Yeah, healthcare not only are affecting everyone at every stage of life, we are really integrated in how we are shifting from this sickness focused care to preventative. How can we prolong life in a way of it's not just about living longer, but living better, right? Like having all these monitors, sensors connecting to different platform, making sure the right information get delivered to the clinical team so they can have a better decision making for all the patients that are using these devices, right? I'm wearing Whoop, people are wearing watches, rings, and then women's health space. Now we have even earrings to detect all these base. And I know you guys have also developed something amazing that's almost like a connection for all these apps that essentially all these data is collecting their own EHR system. But if they're not synced into the existing electronic medical record, and clinicians like myself, if I don't see the data point just because someone's tracking it, then we can't really do too much about it, right? So then you guys created something that helps all these point of care solutions to be connected to all these electronic medical record. So tell us a little bit more about what you guys have built to help these innovative companies.
Yeah, absolutely. Ultimately, it came from that experience of being a technologist and creating those wonderful solutions. But there was one problem, and right back to what you said at the beginning, if they're not being used, there is no point of creating that. Sometimes they would create awesome outcomes for patients, but really they never made it in the hands of clinicians who were in charge of distributing that technology. And one of the reasons is you have to understand exactly what's happening in that world of healthcare. And most of the time, those clinicians, they have up to 50 something technologies they have to use in a regular day. They don't have time to figure out how to use one more and remember one more password. So naturally, point solutions don't get adopted because they're not part of provider workflow. And a lot of times, early stage companies, they really don't have sufficient resources to really solve that problem early on. And this is when we started thinking, what can we offer them? What is available on the market in order for us to really do that true, create that true partnership environment where we can really make a difference? Where is that point of impact? And it was very clear straight away that EHR integrations was that one problem that needed to be solved. It needed to be solved in a way that's most elegant and simple and really not overburdening any of these technologies. So we did create the application. It's really pretty simple. It's a smart on fire tool that allows for all this data that comes with it. It's coming from device, it's coming from maybe sometimes those behavioral interactions become easily available to providers without leaving their HR environment. And really, once we created that, we are now on the second version. We saw how much it changed these pathways, where that pathway to adoption to first pilot became much more streamlined, and even adoption itself has become, when we talk about involvement of IT teams, they changed from maybe spending a week on it to spending an hour on it. So it did make a huge difference for startups.
Exactly, because that also matters from the investment perspective. We always see if you build something, how similar it is with existing product. And then if there are existing product, how easy would this thing be adapted into the market that's existing, right? That being said, that also means adaptability is part of that easy synchronization and easy work already into someone else's workflow. And that means if it's not, then there's a time delay. And if there's a time delay to adoption, usability, easiness of getting something out there, then delay on return. Right. So from an investment perspective, we as people who are angel investors, accredited investors, we have to also think about these type of reason. It's not just simple as, oh, they have a remote monitoring device or they have a remote monitoring platform, but what is it that made them unique, and it's already built so easy for all of us, right? It's not just the clinicians but also the nurses, the MAs, who's actually monitoring these data when there's out of range. Is that all back on the clinicians, right? And then that's the burden to us, or is that also distributed in some way that these companies also have staff that are taking care of some of the preliminary data point? So I have to think everything in a whole package when it comes to deciding whether it's a company that you like to get engaged, be excited with them, help them to grow, right? With your time, expertise, or finances. Now, many people in the health world advisor ecosystem are multi-talented and then being in the industry of health, dental, and wellness for many years. What is your superpower when it comes to helping these early stage or growth stage companies to continue to expand?
I feel like the way I look at the projects a lot of times encompasses so many different components. It's much more than just one streamlined approach. I always question everything. I always ask additional whys where you seem like you came to the point of where you know things. But then once you start digging a little bit deeper, how do you know that something is truth? What makes you think that your hypothesis is the right one? So I always try to bring that point of view that's unbiased as possible, but dig just a little bit deeper. We created those design patterns at one time in order to help startups to really let go of some of the components that they thought is crucial, but in the end, they may not generate as much of a benefit for business as some other ones, and to give them that mindset of how do you quantitatively justify working on this versus that. And I bring it to every component of the business. How do you stay? And that's one of the reasons, right? We came and talked about how you stay focused on something that you really need to give your energy to versus a lot of times startups trying to build too fast or too much. Or I like to use the comparison, you're building wide versus you need to really be building deep. And the same goes for a lot of times when we even help them evaluate that market fit or evaluate that next direction, what is going to happen in the future. Think about it step by step. How do you segregate those steps? So, kind of try to help them just focus on something that really needs to be done and asking difficult questions and not taking just because I said so as an answer. You really, everything has to be validated. That's mathematician in me. I need to have data to support things. So, probably just that, being able to support them with really having very educated decisions every step of the way.
Engineers like you are very methodical, so we always believe in there are multiple different type of languages: physical, emotional, spiritual, but then you add multiple layer of people's perception, what they see important. So that's become crucial for founders when they are building them products, showing to investors, showing to pilot side to say why this is important. So then they need someone like you who are outside that organization to see, are they building too fast? Are they spending too much money or time on something that actually might not be important to the target audience that they're going after, as well as are they needing to have something critical built in so they are seen as high potential and low risk, right? And then we also come from other perspective. A lot of time I come from the clinical perspective, but also as a human execution perspective, because no matter what, your product services, it's just a product service. How you deliver the entire team's dynamic engagement and execution become more important, because the early stage space VCs and angels are betting on the people, not necessarily betting on an established pilot testing the product yet, right? So we do need a different dynamic of skill set to support these founders, and for clinicians themselves we needed to partner up with people like Olga to help us to say, we went to school to diagnose and treat. And when we wanted to switch into the innovation hat, what are the back linking data coding systems so we don't have to start from the ground up? We leverage the people that have those resources, right? So it's always about collaborative team effort and be able to have the right advisor on your board that matches your energy and who understand the true value you're delivering. And that's why we care so much about quality, not just quantity. Now, for you, Olga, what do you think is different about health board advisors than any other ecosystem that you have experienced?
I think it's just that what I started with. While so many boards either lacking that execution or lacking the diversity, health board advisors does have these people with very diverse perspectives that really bring all of these completely different viewpoints and different approaches to the table. And I've seen the actual execution piece of it, where people go in and they fulfill what they said they would do, and they really commit to their promises. And in the end, those are actually functioning boards versus just some theoretical ones. So that's one of the things I feel like of great value and definitely should be appreciated.
Now we know you guys are, as experts, always are creating, building, and supporting others as well. So, what's coming up for you next? The community can continue to support you as well.
Yeah, absolutely. To me, I've always built more, and I came from the background of being a connector. That's another part of me. One is impact, another one is a connection. And of course, impact comes from connection. I do believe it takes a village to really make a difference. So I'm always looking for those with the same mindset who would be able to support those. Specifically, I'm in North Carolina, so I'm actively building this ecosystem that is relatively new for Charlotte, specifically for North Carolina. So anybody who would like to be involved and be part of that, there are so many opportunities to really grow. But overall, it is more about really how do we make this a pathway from the design to adoption executable. People in, whether these are the people in healthcare systems who are in charge of adopting innovation and can advise on how do we build that very quantitative approach to what is the methodology in adopting innovation, how do we make a difference where we have the right technologies or the right solutions, the right methodologies at the table, and they actually make it to the hands of those who are responsible for making a difference.
Exactly. Charlotte is definitely popping up as another innovation hub. Anybody who are in that space in Charlotte area or wanted to start exploring the Charlotte community, please make sure you reach out to Olga. Now, this is Sabrina. I'm your host, and I'm so excited that we had the time to spend with Olga. Link and resources will be in the show note below. And make sure to like our video. This is Clinical Investment Insider, where clinical insight meets strategic capital. I'm your host, Sabrina. Keep building what lasts. Until next time, bye-bye.
Thank you.
If our conversation resonated, share it with another clinician exploring what's next beyond practice. And if you want to explore what it looks like to invest with intention and advise with influence, visit healthboardadvisors.com to explore membership. We connect physician investors with vetted healthcare startups and match you with opportunities aligned to your expertise and goals, from seed to scale.